parts of its objective to providing lasting solutions to the challenges facing healthcare in Africa and beyond. The All African Medical and Awareness Foundation has successfully organized its third edition conference in Abuja with a theme, Medical and Awareness Tourism, Bridging Global Healthcare Gaps. Speaking to newsmen on how Nigerians stand to benefit from the Medical Tourism Conference, the executive chairman of All Africa Medical and Awareness Foundation, Usman Issa, and other participants of the conference have this to say.
We came up with an initiative called AMWE, which is All Africa Medical Awareness Expo, where the main or the brain behind or the motive behind the AMWE is to join our local healthcare service providers, those are the helms of affairs, to profile lasting solutions to what is depriving many Nigerians and Africa at large access to quality and specialized medical treatments. Our approach is unique, our initiative is unique, first of its kind in the history of Nigeria. The reason why I say so is not far-fetched. Is first in history of Nigeria for health sector and tourism sector to come together, not to dance or play or for cultural things, only to brainstorm and implement solutions to the challenges we're facing in our health sector. Thank you. Well, we have a participant from 11 countries. The countries are United Arab Emirates, UAE, Saudi Arabia. We have about 5 people from Saudi Arabia. We have people from Pakistan. We have people from Egypt. We have people from Thailand, Singapore, and others. First message that I have to pass to Nigerians, my first message to go to those at the helms of affairs, the policy makers, the government, top government official. They should wake up and provide enabling environment for local healthcare service providers. As you know, we have medical personnel that are doing wonderfully well in Nigeria, but because of lack of enabling environment, many of them are not known. And we all know that many of our medical personnel, doctors abroad, they are there in good numbers, giving good name to foreign hospitals. And with this initiative, if government can provide an enabling environment for our local healthcare service providers, removing heavy taxes on our local healthcare service providers, making supportive policy for our local healthcare service providers, all things we are lacking in Nigeria, everything will fall in shell because
I'm handling the global health way, and this is our brochure that we are sending patients who are willing to be treated, diagnosed or treated in Turkey. That's what we are doing. And Musiad is an NGO in the same time. We are independent industrialist businessman associations. Objective, our aim is here improve the business relation, import-export, and investment relation between Turkey and Nigeria. That's what we are working for. Because I always say Nigeria is one of the 4 doors of the African continent. Nigeria is a very important country. That west door of the African continent is Nigeria, if you want to enter this continent. So our aim actually is not only in Nigeria especially, but the whole Africa, especially the West Africa. that's what we would like to share the Turkish businessmen's achievements and experiences with the Nigerians. That's why
I'm a radiotherapist and public health specialist. I work at National Hospital and I run my NGO Call of Cancer Initiative, and I'm the convener of Area Cancer Control Coalition. I am a cancer advocate. I advocate for cancer, for non-communicable diseases, and for youth health, the health of young people. Here as a moderator in one of the panels, I think the central message here is collaboration, because if we want Nigeria to be a hub of medical tourism, we can't do it alone. We have to have partnerships, we have to have collaborations, and we have to make sure that we use this as an opportunity to collaborate. All these foreign partners that are here, the visitors that are here, it is our chance to join hands together and also learn from one another, because they have a lot that we can learn from, and I'm sure we have so much that they can also learn from. Partnerships doesn't mean that we are following them to learn from them only. They also have something to benefit from us, to learn from us. So I think whether it's business to business, whether it's business to consumer, whether it's business to government, there is a lot that can happen in this space, and we should do these things more often. As a therapist, I treat cancer and I see what the communities go through. I see this showing up of awareness, and the only thing that came to my mind is how can I make this better, and that was how Call of Cancer Initiative was born. I am trying to make the community aware of cancer, aware that it can be prevented, aware of the predisposing factors so they protect themselves and prevent the occurrence of this disease, because once they happen, it's taken like a death sentence, which is not. But if we can help prevent this disease, even if it happens, we can catch it early and it can be treated, and we don't end up losing lives to cancer, especially in this part of the world. Over 50% of the patients that have cancer end up dying from it, and this shouldn't have happened. This shouldn't be happening. So that is basically what we do. We help patients with navigation. We help them with access to care. We advocate for both patients and also for policy advocacy. We advocate to the government. We are part of policy engagement. Even now, I'm rushing to go to a meeting that is about health policy, and that is how we do our little bit to make things better, make the healthcare. callofcancer@gmail.com is our NGO, and we are on Instagram, we are on Facebook as Call of Cancer Initiative, and we can also share our contact 07052088166. You can reach out to us anytime, and we will try our best to see that we help with navigation, we help with support, and we help with the information that patients need, because most times, before you even talk of the money, the finances, patients are even clueless as to what do I do now that they say I have cancer, what do I do? So if you need that support, we are here to give you that support and navigation.
Okay, before now, I didn't know much about medical tourism, but I'm glad to be part of this program because it has exposed my mind today, even yesterday, towards medical tourism, and then how collaboration with some other hospitals abroad as well. Yes. We're here to see how we can collaborate with some of these hospitals. As you can see, there are some people, CEOs coming from big hospitals all over the world. So we'd like to see, right now I even have some of their contacts. We'd like to see how we can collaborate and work in the future with them.
Okay, essentially the message is that people need to know, Nigerians need to know that we have available dental treatment here in Nigeria, in Abuja and in Lagos, that typically takes people outside the country. Now we're saying that we're trying to do reverse tourism, so people should actually come into the country here in Nigeria to have these dental procedures done. We are a technology-driven dental clinic, so all our procedures, all our processes, our treatments are all driven by technology. I know with technology there is quite the precision with treatment and all of that. So we want to tell people that look, you don't have to go out of the country to access dental care. You don't have to go out of the country to achieve your desired smile. You can have it here, right here in Nigeria, in Abuja and in Lagos. Generally, apart from our services, which spans from family dentistry, pediatric dentistry, prosthodontics, orthodontics, that is implant dentistry, cosmetics, and of course to the basic dental, cleaning, just cleaning and polishing. We have products, good upscale dental products that are good for teeth. Particularly, we promote Curaprox products. You can check them out online. They are ergonomic, they are healthy, and they're recommended by our dentists for dental use.
The 3-day event featured 7 district experts, which were exposed to valuable information that could help them make better choices with access to key health and wellness knowledge, experts and products. Augustus Oche Ifene, Delegate TV, Abuja.